Thank you, GQ. Have a great Monday to you as well. Well, if you have trouble sleeping or you have sleep apnea, we're going to address this issue because we have our Ask a Specialist segment every Monday, and Dr. Steve Wilhite from the Queen Sleep Center is here with more. Hi, doctor.
Hi.
So first off, we're talking about sleep apnea, and you have some devices this morning that are able to kind of treat some of the symptoms and the signs of apnea, but there isn't necessarily a cure, I'm guessing.
No, but the gold standard is the mask, the CPAP mask, and the medical specialists will fit those. Now, some people can't wear those for several reasons, and the ones with mild to moderate apnea, they will make the oral appliance for them. And how these work is they hold the lower jaw forward, and your tongue's hooked to your lower jaw, so it keeps the tongue from closing, falling back and closing off the airway.
Okay, and so you brought a very special mouth device, oral device that you wanted viewers to see. Tell us a little bit about this one.
This is actually developed one of the first appliances in the United States at Queen's Hospital by Peter George, a retired orthodontist, and Bruce Soule, a pulmonologist. It was rigid, it was fixed, it had that beak coming out of the mouth, and so it was hard to get it comfortable. And people didn't like it because of the beak, and they couldn't travel with it. A lot of people travel here on the red eye, and they'd have this sticking out of their mouth. And so right now there's over 80 designs, and they all work the same by bringing the lower jaw forward and stabilizing it. This is one of the most popular brand, Somnimed right now. It looks horrible. These are removable. This little holds against a hinge over there. I know that looks bad, but it actually is pretty comfortable. Here's one that actually fits my mouth. This is a Clearway, actually developed out of UBC up in Vancouver. And this is the one we've made the most, and it's adjustable. I'll put it in real quick, show people how comfortable it is. So it goes in, you drink, move your jaw.
And so it just causes the lower jaw to kind of protrude out more.
It does. About 60% of its maximum distance, and so we try to hold it there, and by stabilizing the manually, the tongue will stay forward and it won't close off the back of the airway, so people can
and so as a dentist, it's your job to fit these people with the, would you call it a mouth guard?
Or it's an oral appliance.
Oral appliance, yeah. Okay. And so there's actually a free workshop on Wednesday at the Queen's Medical Center. Tell us what that's going to be about.
Well, Roger Yims, head of the sleep clinic, he will actually lead it off and talk about sleep apnea and snoring, and then we'll talk about different modes of treatment, the CPAP mask, and then we'll have some of the oral appliances there and talk about how they work also.
And so the mask is kind of like the last resort?
No, it's the first resort. It's the gold standard. Okay. Only do we go to this, or sometimes we'll go to surgeries where people will actually have their back of their throat lasered off, the procedure UPPP. But we try to, people with mild to moderate apnea, we try, if they can't wear the mask, then we'll try the oral appliance next. Okay.
And so if you have any questions about sleep apnea, or you may suspect that you have sleep apnea, you can give the Queens a call and let them know at 537-7117 that you want to make an appointment and be a part of that free lecture on Wednesday.
Thanks.
So thank you, doctor, for joining us, and this is very interesting.
Thank you.
I have a mouth guard, but it's not for sleep apnea.
No.
Well, top headlines are coming up next. We're going to let you know also what's happening.